We're at the Global Health Policy Centre's annual conference, Pharmaceuticals and Innovation, Inequalities and Health, and we're about to go and talk to some people to find out what they think about the conference and to find out what they think are the major issues in global health at the moment today.
I think we had a really good opening session running all the way up to lunch. We began to identify the key challenges around getting an increase in access to pharmaceuticals. I think one of the most important questions that came out was to look at the different needs that exist in different countries in terms of getting the pharmaceuticals to the people who need them.
The conference this morning has been quite controversial. Lots of interesting views, but lots of really quite argumentative comments from the audience, which has been great. So lots of debate and discussion already. Looking forward to this afternoon.
I was just interested in how the representative from the pharmaceutical industry presented their information. I found that very interesting. I wish we had more time to talk to them about their sources, especially in relation to access of pharmaceutical drugs and stuff. There's this conversation about, access is better than it was before.
To me, it was really interesting that it really highlighted the importance of intellectual property rights that is underlying all of these discussions about global health, and especially where it comes to discussions of access to medicines. Intellectual property is always part of that. So that was my.
And I just was delighted to see that the keynote speaker was an anthropologist to introduce a more kind of broadly ethnographic perspective into debates that are often very scientific and dominated by more medical perspectives.
And my main interests are in pharmaceutical innovation in general, not specifically development. And so what I've enjoyed from the meeting so far is trying to think through how some of the work that I've been doing with colleagues here in Sussex on sort of crisis in pharmaceutical productivity and the global restructuring of the global pharmaceutical industry plays out and is relevant to the debates about appropriate medicines and the development of new medicines for neglected diseases.
We're really interested to hear people's views on actually how you treat and look for drug patient populations in the developing world.
I was particularly interested in three things today. The first was in whose interest is eradication of HIV. Of course, we know that it's all our interests, but actually why is that now on the agenda, particularly at a time when we know that money towards HIV/AIDS financing is on the decline? So who's going to pay for this? And who's going to pay for this uptake in treatment? Lower middle income countries at the moment are really struggling to pay for antiretrovirals and will struggle even more once those donors start to withdraw. I also think what was interesting is the role of middle-income countries and how middle-income countries are going to afford to reform their health systems. And finally, I think what we should consider is the role of economic partnership agreements that are now happening in the world of trade, which really is going to challenge the patent system going forward.